living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Over-the-counter and prescription pain relievers can help treat a variety of problems, but they can also come with risks. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today, we're going to take a look inside your medicine cabinet and see what you're using to help treat pain, and also what your doctor might be prescribing you. Stay with us. We'll be right back after these messages. Welcome back to Healthy Living for Life. Today I'm being joined by Tony King, who is the pharmacy manager at Mountain Pacific Quality Health. And thanks so much for being here today, Tony. We appreciate your time.
Thanks for having me.
So we're going to talk about over-the-counter painkillers today. And let's first talk about non-steroidal anti-inflammatory drugs, or easier said, Nsaids. What does that classification NSAID mean?
It is a class of medications that treat inflammation in the body, which is a marker. When your body thinks something is going wrong, it activates a system and causes inflammation, so it triggers things in your body that will help treat that problem. So the NSAID class really tries to knock down the inflammation in it so that it doesn't hurt as much or it doesn't bother you as much, and then still also lets the body take care of what other might be bothering it.
What are some common examples of NSAIDs that people might hear more often than NSAID?
Yeah, a lot of people think that all over-the-counter pain medications are NSAIDs. They're not. Really, the most common ones are ibuprofen and naproxen. Ibuprofen, you know, as Motrin or Advil. And then naproxen really is Aleve. Other people may think that Tylenol and aspirin. Aspirin technically is an NSAID, but it works a little bit differently. But really, when we're talking about NSAIDs specifically, we're talking about ibuprofen and naproxen for over-the-counter.
Okay, so let's talk about those medications that are over-the-counter that aren't Nsaids. What are the differences, and what are some of those? Sure.
Tylenol is the other one that most people take for some pain. It is strictly a pain reliever. It doesn't help any anti-inflammatory or any inflammatory response in the body. Okay. It only does pain. It triggers something in the brain, and it tricks the brain into thinking there's less pain there. Aspirin is an anti-inflammatory at a higher dose, but usually what we're taking aspirin for is for platelet or blood clotting issues. You really need to up the dose in it for it to get that anti-inflammatory response on it, but most people don't take it for that anymore.
Okay. So we can get pain relievers over the counter. Other pain relievers are prescribed. Why is that?
Most often it's due to the side effects of those prescribed pain relievers. Also, it's really important that we're taking the medications correctly and we're not masking a problem. So the over-the-counter medications that we're taking are for really light pain, not extensive heavy pain or things from traumatic injuries. Really, we're just using it maybe for small ailments, but not really car crashes, things like that. So the prescription ones are a little bit higher dose. They come with side effects and they come with more warnings and precautions.
Okay, and we'll talk about that a little bit more here in a minute, but let's switch gears and talk about topical pain relievers. There are ones you can get over the counter, correct? Can you talk about some of those?
Yeah, there's several different classifications of them. Some of them, like menthol, Vicks Vapor Rub, they kind of just give a cooling sensation, so it tricks the brain into thinking that it's not hot or it doesn't have inflammation anymore. Some of them, lidocaine, actually kind of numbs the area. And then there's ones that have capsaicin in it that treat a substance called substance P, which is what the body perceives as pain. So it kind of pulls some of that out of there so the nerve endings don't trigger with pain anymore. But a lot of them just have to do with temperature differences, so tricking the body into thinking that what may have been wrong isn't wrong anymore.
So when it comes to pain relievers, should we be paying attention to brand names, or is there any benefit between brand names and generic?
There really isn't at this point. They have the same ingredients in it. Some people swear by one product over the other. Some of them want gel caps. Some of them want, the enteric coated tablets. Really, it's personal preference. Some people think that the gel caps may work 20 to 30 minutes faster. Some people swear by name brand, but really they have the same active ingredient in it. So whatever you're comfortable with and has worked for you in the past, that's generally what I recommend.
Okay, great. So some viewers may have heard non-selective NSAIDs and COX-2 selective NSAIDs, which I hadn't before talking to you, but what do those mean? Sure.
Non-selective NSAIDs work on an enzyme in the body. They actually both do, but there's COX-1 and COX-2. The COX-2 inhibitors are prescription products only at this point. They are still NSAIDs, but they're prescription products. They were developed hoping that there would be less side effects. When you're inhibiting an enzyme, there's going to be side effects down the chain. So if we can just target the ones that may affect specific parts of the body and not the other parts, then the side effect profile goes down. Really what they found though with the COX-2 inhibitors that are prescription products, they may not be as beneficial as they once thought. And the safety profile of them hasn't shown the benefit that they thought they would get.
So when it comes to over-the-counter pain medications, what do you typically recommend as far as what are those used to be to treat?
Sure. Again, we need to take a look at the ailment, what's causing the issue, make sure we're not masking a bigger problem that may need to be seen by a provider. We need to take a look at the medication history, what you're on before, make sure there's no interactions in there. Generally, ibuprofen works for 6 to 8 hours. Naproxen works 8 to 12 hours depending on what you're on and what your body does. So really those are the two that I go with, and then if we're dealing with some kiddos, sometimes they may need to alternate some Tylenol in there for that added benefit.
Okay, we only have about a minute left, so really quick, when you get prescribed a pain reliever, what typically do you get prescribed?
Again, it depends on the ailment, depends on what the issue is. A lot of times it'll just be a higher powered NSAID, hopefully to start with, and then if it's really problematic or it's going to be really painful, they'll go up to an opioid prescription pain reliever, and I know we'll probably talk about that a little bit later, but there's some, it just kind of depends on what it is, and there's some complications with all of them.
Okay, and we are going to talk about that in just a little bit, but we're going to pause here for a quick break, and when we come back, just as Tony said, we're going to talk about some of those risks and side effects that can come along with pain relievers. Stay with us. We'll be right back. Welcome back. We're still talking with Tony King, who works with Mountain Pacific Quality Health and is our pharmacy manager there. And thanks again for being here today, Tony. So let's talk about some of the risks when it comes to over-the-counter pain relievers, and we'll start with acetaminophen. So I think we may have talked about this, but when we say that, we just mean Tylenol. Is that correct?
Yeah, in this country, acetaminophen is Tylenol. It has some different names in other countries, but that's what we can get it at here.
Okay. And so what are some of the risks with Tylenol?
And again, Tylenol is a little different than an NSAID. It doesn't have the anti-inflammatory, and it doesn't really affect the platelet or the clotting in the body as much, but high doses of Tylenol can be really bad for your liver. And again, we don't want to mask other problems with it. If you're taking Tylenol on a daily basis, there's probably something else going on, so we really need to dig deeper into what's going on in the body.
Does aspirin have different risks than acetaminophen does?
It does. Aspirin is more in line with the NSAID category. And again, higher doses with that, it does affect how the body, the blood clots in the body. So it can cause stroke, it can cause ulcers, it can cause bleeding, and it also is really tough on the kidneys versus the liver that the Tylenol warning has.
Okay, and before the break we also talked about ibuprofen, and so different risks there as well?
Closer to the aspirin one, but really with the ibuprofen, naproxen, long-term use can cause ulcers, it can cause stomach problems, which then lead to some bleeds and things like that. Also pretty tough on the kidneys if used long-term in high doses, so really need to talk to the doctor and make sure that's the appropriate regimen.
Okay, good advice. So in general, NSAIDs kind of the same risks across the board?
Yeah, for ibuprofen and naproxen, yeah, they're going to have the same side effect profile.
Okay, so let's talk about some of the risks and complications then when it comes to not over-the-counter but prescribed pain relievers. So let's start with opioids, which that's a huge concern in our country right now. What are some of the potential side effects when it comes to opioids?
Sure. Most common side effects with opioids, nausea, could cause some constipation, can cause some upset stomach, but it also suppresses the central nervous system, meaning it makes you drowsy, makes you have a cloudy head. You're not making the same decisions that you have, possibly being tired or falling asleep when it's unexpected.
And when we talk about side effects, that's not the same as risks, is that right?
That's correct. So with the opioid medications and most controlled substances, all controlled substances, you have a potential of becoming dependent on them. So your body thinks that it needs it all the time, and when you stop taking them, you go through withdrawals, and then you have a really tough time not being able to have those in your system.
And so we've started calling the opioids issues that we have in this country, it's a pandemic that we're seeing. A lot of people are struggling with opioids. So what are doctors and prescribers and pharmacists too doing to kind of help with this issue in our country?
Sure, it has gotten a lot of attention lately, but still not enough. We're still seeing the side effects of, possible overprescribing. There was some targeting from the drug manufacturers to try and prescribe these, not giving enough light to the side effects. So there's a lot of studies going on right now to see what the appropriate dose, how long people can be on it. Is it 2 days? Is it 3 days? Is it 7 days? Some people start becoming dependent on it just after a couple doses. So there's a lot of research and a lot of studies going on to see for which ailment, what is the appropriate dose. For a broken bone, is it 3 days? Is it for a sprained ankle? Is it 1 day? Wisdom teeth, things of that nature. So trying to standardize those as much as possible, having good guidelines, getting the word out there, and just sharing that knowledge with all the medical professionals.
Are there certain people out there that should just be cautious about pain relievers no matter what, either over the counter or prescription? Yeah,
absolutely. Females who are going to become pregnant, that's obviously a risk. Nsaids, they're finding Nsaids used in that 20 to 30 week window during pregnancy could cause some additional problems. Folks that have had blood clotting issues in the past, heart attack, stroke, things of that nature. If you're on other medications as well, there's always some side effects or interactions that can take place. So really it's just a good idea to talk to your doctor and your pharmacist to figure out what you need and what's going to be best for you.
Okay, perfect. And those people who may not need to necessarily be cautious, when do they know whether they can take an over-the-counter medication or if they should go ahead and take what was prescribed them?
Well, the recommendation is to get by if you can go without. So if you can go with an over-the-counter and get by all means. One thing about the U.S. is we consume 95% of the opioid medications in the world. So wow. In other countries, they don't get opioid medications for things that we get them for. So if you can get by with an over-the-counter, ice, elevation, if you can do some physical therapy and not get into the prescribed products, it's going to be better for you in the long run.
Okay, great. We're about to come up on another break here, but anything else we should touch on or talk about when it comes to risks and painkillers?
Sure. I think really important to know is that all these medications come with side effects, and they all probably interact with some other medications. So it's really, really important to talk to your doctor and your pharmacist. Tell them what you're on. Tell them the over-the-counter medications you're on, any supplements, any nutritional products that you're on, and even diet. Sometimes folks that are on blood-thinning medications need to be wary of their diet and changing of diet of that nature as well.
Okay, that's good to know. All right, Tony, thanks. We are going to pause here for another break. But when we come back, we're going to continue talking about some of the safety precautions you may want to take when it comes to over-the-counter or prescription pain relievers. Don't go away. We'll be right back after these commercials. Stay with us. Welcome back to Healthy Living. We are still talking with Tony King with Mountain Pacific Quality Health, who is an expert pharmacist sharing his expertise with us this morning. And earlier we talked about the different risks and some of the side effects that come with painkillers, but we know there is a bigger issue going on in this country. We talked about it a little bit before the break, but let's expound on that a little bit. Can you tell us what exactly is going on in this country when it comes to painkillers?
Yeah, and it was identified a number of years ago that we are prescribing and ingesting way more opioid narcotic pain medications than in previous years, and the number of overdoses and people seeing physicians in the ER for those medications is skyrocketing. There's been a lot of focus on that in the last couple of years. There's been a lot of public communication efforts. There's been a lot of efforts in the professional community as well on how to identify this. However, since we've been in the pandemic and coming out, the DEA and CDC have released numbers that show that number skyrocketed during the pandemic. So a lot of the progress that we made in the years leading up to that has been wiped out due to the pandemic and lack of being able to get to their healthcare provider, lack of follow-up testing, lack of treatment center availability. So a lot of folks right now are struggling with this epidemic and being addicted to opioid pain medications. With the lack of being able to get to the doctor, a lot of them are turning to illegal substances, heroin being on the rise in a lot of places. And we're not just seeing it in the East Coast like we used to. The Midwest has seen a giant spike in the last couple of months of not only overdoses that are going to the ER, but folks turning to street drugs in order to treat that addiction.
And you mentioned the CDC putting out reports, and that's the Centers for Disease Control and Prevention. They've also been talking about that we are seeing higher overdose deaths than we've seen. Can you talk about that, especially among women? So why is that, and kind of talk about some of those numbers?
Sure, and statistics will show that females get more opioid prescriptions than men, but men get higher doses in those prescriptions. So females get lower numbers, fewer pills per prescription, and that's just probably education from both sides, both the professional community as well as the public. Right now, just due to the lack of health care, people are going to more providers trying to find who they can get into, who they can see that will treat them. There is a big effort with the prescription drug registries in several states trying to make sure that they're not doctor shopping or utilizing more places, but it's just harder to get that. And again, as they can't get in to see their regular provider, or they start losing that ability to go to their treatment centers, things like that, they are turning to some of the street drugs. And unfortunately, some of the street drugs have what's a substance called carfentanil or fentanyl in it, which is way more potent than the opioid that they used to take, and so they're seeing a lot more overdoses from that.
And so you mentioned going to the emergency department. I have a stat here that the CDC says every 3 minutes in the U.S. a woman is going to the emergency department for prescription painkiller abuse or misuse. So is there something happening at the federal level of trying to regulate this a little bit more, or what's the effort to combat this whole thing? Sure,
there is a lot of federal effort as well, but it really needs to funnel down to the local level. The federal push is to give more money and more resources to the states, and then the states funnel it down. They're trying to up the number of treatment centers throughout the U.S. They also just announced that they're going to have mobile treatment centers, which is the first time that they're allowing this. So those centers that people who are addicted to opioids come and get their treatment, they can go to different smaller communities instead of having those folks come to their center, transportation being an issue, obviously, especially during a lockdown. So they're expanding their reach. They're trying to do what they can. It's just going to take a collective effort of the federal, state, and local jurisdictions to try and help this epidemic.
Okay, and then what about at the healthcare level? You mentioned earlier too about some need for education. Is that going on, or what else are doctors and pharmacists doing?
Yeah, and the federal level, the DEA also just kind of reversed one of its stances. It's now allowing more providers to treat people who are addicted to opioids. You used to have to go through a training program and get a waiver in order to treat someone that's addicted. They've opened that up to all providers if they're doing it on a small scale. If you're going to do larger numbers, they still need to have that waiver, but they're allowing more physicians the ability to help treat. They may have been ones that also prescribed but couldn't treat in the past. So more local community physicians and mid-level practitioners are going to have that ability to start treatment programs and to get them on medication or other resources to help them stop the opioids.
So for just people like me who are listening to this, are there things that I can be doing to help with this? Are there symptoms I should be looking for? How can I help someone that I'm worried about?
Yeah, just keeping an eye on them, really just noticing any change of behavior. Are they more irritable? Are they complaining about ailments more than they have? Are you noticing them saying they have to go to the doctor more frequently? Just any changes in behavior or pattern might be a sign of that. Asking for money is one thing that seems to pop up for some of those folks. But just anything that might be different, and it's just worth a conversation.
If I have a friend or loved one who may be overdosing, what do I do?
Call 911. That's the first thing to do in an overdose situation. Hopefully, the 911 operator will walk you through what you need to do. If they are someone that's been on opioids, hopefully they have been offered or prescribed a reversal agent, and then that's really easy to use. But call 911, tell them the situation, and help will be on the way.
And that reversal agent, you're talking about Naloxone, is that correct? Can you talk about that?
Correct. Naloxone is a reversal agent. It's been around for a long time, actually, but it's gaining popularity right now. It is most often a nasal spray. You just put it inside the nostril, pushed on both sides of the wings, and the spray goes in, and it will reverse the opioids in the system. It's important to note, however, that you may need more than one spray. The half-life, or how long the opioid stays in the body, is longer than how long the half-life or how long the naloxone stays in the body. So a lot of times they'll come out of that, and then a couple hours later they'll fall back into that overdose. So after that first one, they still need to be on the way to the ER, similar with an EpiPen.
Okay. All right. Great. We are just about out of time. Any closing thoughts today, Tony?
No, I appreciate it. Just make sure that you're talking to your physician. Make sure you're talking to your pharmacist. Walk through all the medications that you're on. Ask any questions. Just try and be comfortable with it and stay safe.
Okay. Perfect. Thank you so much for your time. We appreciate it. And thank you so much for joining us today. We hope you'll come back and watch us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. We'll see you all next week. Thanks so much.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.